heart disease. So coronary artery disease is a common type of heart disease. It affects the main blood vessels that supply blood to the heart, called the coronary arteries. So during this, there's a reduced blood flow to the heart muscle. Buildup of fats, cholesterol, and other substances occur on the artery walls in a condition known as atherosclerosis, and this usually causes coronary heart disease. The buildup, called plaque, makes the arteries narrow. So this disease develops over many years. Symptoms are from the lack of blood flow to the heart. So these can include chest pain and shortness of breath. There's a complete blockage of blood flow which can cause a heart attack. And treatment can include medicines and surgery, eating a nutritious diet, getting regular exercise and not smoking can also prevent it. And it can also be called coronary artery disease. So symptoms of coronary artery disease occur when the heart doesn't get enough oxygen-rich blood. So these can include chest pain, called angina, so you can get squeezing, pressure, heaviness, tightness or pain in the chest. It can feel like somebody's standing on your chest. So the chest pain usually affects the middle or left side of the chest. Activity or strong emotions can trigger angina. So there are different types of angina. So you can also get shortness of breath, so you can feel like you can't catch your breath. Fatigue, you can feel unusually tired if your body can't meet your blood needs. And symptoms of coronary artery disease may not be noticed at first. Symptoms, however, only happen when the heart is beating hard, such as during exercise. As the coronary arteries continue to narrow, symptoms get more severe or frequent. A completely blocked coronary artery will cause a heart attack. Common heart attack symptoms include chest pain, which feels like pressure, tightness, squeezing, or aching. Pain or discomfort which spreads to the shoulder, arm, back, neck, jaw, teeth, or sometimes upper belly. Cold sweats, fatigue, heartburn, nausea, shortness of breath, lightheadedness, sudden dizziness. But chest pain is the most usually common symptom. So coronary artery disease is common. So there are risk factors such as age. So age increases the risk of damage to narrow arteries. Men are most at risk of it, but for women it does increase after menopause. If you have a family history of it, you're more likely to get it. There are factors we can control, such as smoking. So quit smoking. So smoking is bad for the heart. High blood pressure. So uncontrolled high blood pressure can make the arteries hard and stiff. This can lead to atherosclerosis, which causes coronary heart disease. Cholesterol. So too much cholesterol in the blood can increase the risk of atherosclerosis. So there's bad cholesterol called LDL, and there's also not good enough cholesterol called HDL, which can also high density lipoproteins can also cause atherosclerosis. Type 2 diabetes as well are risk factors. Too much body fat is overall bad for the health. Obesity as well. Chronic kidney disease. So if you have long-term chronic kidney disease, this can be a major problem as well. Not getting enough exercise. So you need physical exercise for good health. Emotional stress and unhealthy diet. So eating foods with a lot of saturated fat, trans fat, salt and sugar can increase the risk of coronary heart disease. You also get complications. So chest pain called angina, this is a symptom of coronary heart disease. This can also be a complication of worsening CAD. The chest pain occurs when the arteries narrow and the heart doesn't get enough blood. So you get a heart attack. So a heart attack can happen if atherosclerosis causes a blood clot. A clot can block the blood flow, and the lateral blood can damage the heart muscle. So the amount of damage does depend on how quickly you're treated. You get heart failure. So narrowed arteries in the heart or high blood pressure can make the heart weak or stiff. This can make it harder for the heart to pump blood. You can get irregular heart rhythms, also known as arrhythmias. If the heart doesn't get enough blood, changes in the heart suddenly can happen. This can cause irregular heartbeats. So blood tests can check blood and cholesterol levels. So a high sensitivity C-reactive protein test for protein-linked inflammation of the arteries. You can get an ECG or an ECG done. So this checks the electrical activity of the heart. It shows how the heart is beating. Sticky patches called electrodes attached to the chest and sometimes the arms and legs. Wires connect the electrodes to a computer which prints or displays the test results. The ECG signal patterns can show if you have or having a heart attack. You have an echocardiogram. So this test uses sound waves to show blood flow through the heart. Parts of the heart that move weakly can be caused by a lack of oxygen or heart attack. This can be a sign of coronary heart disease or other conditions. You can have exercise stress test. So this is where you walk on a treadmill or ride a stationary bike while your heart is checked. Because exercise makes the heart pump harder and faster than it does during most daily activities, exercise stress tests can show heart problems that otherwise might be missed. If you can't exercise, you may be given a medicine that affects the heart like exercise does. Sometimes an echocardiogram is done during an exercise stress test. You have a nuclear stress test. This shows how the blood moves to the heart at rest and during activity. It uses a small amount of radioactive material called a tracer or radio tracer. The substance is given by intravenously. An imaging machine takes pictures of how the tracer moves to the heart arteries. This helps find areas of poor blood flow or heart damage. You have a heart CT scan, which can show calcium deposits and blockages in the heart arteries. Calcium deposits can narrow the arteries. Sometimes dye is given by the IV during this test. The dye helps create detailed pictures of coronary arteries. So if the dye is used, the test is called a CT coronary angiogram. You can also have cardiac catheterization angiogram. This can see blockage in the heart arteries. So you get a long, thin, flexible tube called a catheter on a blood vessel, usually put in the groin or wrist. So it's guided to the heart. The dye flows through the capillary arteries in the heart. The dye helps the arteries show up more clearly in X-ray images and videos. And heart treatments can also be done during this test as well. So treatment for coronary heart disease can include lifestyle changes such as not smoking, eating healthy and exercising more, medicines such as cholesterol, aspirin, beta blockers, calcium channel blockers, ARBs, nitroglycerin, and ranolazine, and heart procedure, heart surgery, so a coronary angioplasty and stent placement, or coronary artery bypass graft surgery. So cholesterol medicine, this is to lower the LDL cholesterol and reduce the plaque buildup in the arteries. These include statins, niacins, fibrates, and bile acid sequestrants. Aspirin to help thin the blood and prevent blood clots. So if you have a daily low dose aspirin, this can be used for primary prevention of heart attack or stroke in some people. It can have serious side effects though, including bleeding in the stomach and intestines. Beta blockers, so the medicine slows the heartbeat and lower blood pressure. So beta blockers can be used to reduce the risk of future heart attacks. Calcium channel blockers. So one of these medicines can be suggested if you can't take beta blockers or beta blockers don't work for you. Calcium channel blockers can help reduce chest pain. You can have angiotensin conversion enzyme. So AC inhibitors and angiotensin 2 receptor blockers, ARBs. These medicines lower the blood pressure. It can help the coronary artery disease from getting worse. You can have nitroglycerin, which widens the heart arteries. It can help control or reduce chest pain, and it's available as a pill, spray, or patch. You can also have ranolazine, so this can help people with long-term chest pain. So it is prescribed with or instead of a beta blocker. Surgery can also be done to fix the blocked artery and improve blood flow. So these include surgeries such as coronary angioplasty and stent placement. So this treatment opens up clogged vessels in the heart. A tiny balloon on a thin tube called a catheter is used to widen a clogged artery and improve blood flow. A small wire mesh tube called a stent can then be placed to keep the artery open. Most stents are coated with medicine that helps keep the artery open. So this treatment is also known as percutaneous coronary intervention. You can also have coronary artery bypass graft surgery. This is a type of open heart surgery. So a surgeon takes a vein of artery from somewhere else in the body. The surgeon uses the blood vessel to create a new path for the blood to go around a blocked or narrowed artery. The surgery increases blood flow to the heart. So there are other stuff you can do, such as having fish oil, sources of omega-3, also other oils such as alpha-linolenic acid, which are found in canola oil, soybeans and soybean oil, and supplements as well such as barley, psyllium, oats, garlic, plant sterols, etc. But if you are looking at lifestyle changes, you need to stop smoking, eat healthily, and get regular exercise to maintain a good weight. So that's the end of today's video. So hope you've enjoyed this one, and hopefully see you in the next one. Please remember to like, share and subscribe. Bye bye.